misconceptions. And, hopefully I can clear some of that and help you guys out as best as you can. But really use me as your resource. I love helping, and this is why I do this. All right, so what are we going to do? We are going to talk about the question of why do we need extracurriculars? It seems like a simple question, but people misunderstand this all the time. And so I just want to really just state clearly why we look at your extracurriculars, why there's a lot of space in the AMCAS to write down what you've done and why you've done it, and how you can stand out. And I'll try to dispel as many misconceptions as possible. And I have a little quick workshop, first draft versus second draft, and I'll just go through it with you why it makes for a good work and activities description. And then lastly, we can just have a general Q&A. You can ask me anything you want. We can talk about fun stuff too, since you guys are here on a Saturday. Let's get started. So I always start these with a story of my students. Story of Ryan. So Ryan was a student of mine who joined me starting his sophomore year. And he was quite frustrated because he was like, I want to enjoy my college career. Like, why do I have to do this? It seems like, there's a lot of things you got to prepare. And, he asked me for advice in terms of what to pursue. And the question he has to me, I get all the time, which is like, what activities do I have to pursue in order to stand out? Like, is it just like XYZ? Is it like Y? Like, what is it? Like, I don't know what it is. And so let me just dispel one misconception right away for all of you guys. You're not going to surprise your admission committee with the activities that you've done. Sorry, you're not. We've seen it all, seriously. And so you're not going to blow us away and get admitted because you've done like something really super cool that no one's ever heard of. You might have one or two of those things, but it's not gonna be what gets you in. So how do you stand out then, right? So I'll get into more of that. So this comes from SDN. I searched up. I remember when I was preparing for this talk, what I need to do as a pre-med to get into med school. This is the list I got. Clinical volunteering, research, shadowing, leadership, teaching, mentoring, student group, hobbies, sports. Like, wow, that is a lot of stuff, man. It's like asking me to be a Superman. A lot of students are like, do I need to do this? Why do I need to do this? And I see that a lot of students just go for it. Like, they just go for all of these, try to do as much as possible while maintaining their like 3.95 GPA. And like a lot of students come to me, they're like miserable. They're like, I don't want to do a lot of these. Why am I doing it? Okay. So let me just break it down for you. And I encourage you guys to think about the following. Whenever someone is telling you to do something, whether it's SDN, whether it's a consultant, whether it's a service, anything, think about the root reason why that they're asking you to do it. If they don't have a reason, don't do it. Okay. It's as simple as that. So here's the reason why these activities are quote unquote useful and why it's been kind of propagated that we will look for these activities when we're looking at your application. So clinical volunteering, why do we care? We want to make sure that you're sure about medicine. Medicine is a long road, right? Like seriously, some of my classmates are still pursuing training and it's been years. And some go through gen surge. Some want to be cardiothoracic surgeon. It's like 9-10 years after med school. Okay. It is a long road. The question that we ask you guys is, if we admit you as one of 150 students, are you sure you're not going to drop out? Are you sure you're going to be a doctor? We don't want to waste that spot, okay? So clinical volunteering is a way for you to tell us that you're committed to medicine, right? Shadowing serves the same purpose. And so when people ask me, like, how many hours of shadowing do I have to do? How many hours of clinical volunteering do I have to do? I tell them this, there's no set hours that you need to do. If you can convince me that you want to do medicine and that it's just like a path that you've been at it, one way to do that is by giving me the fact that you've done 500 hours of clinical medicine, right? Work, right? Whether it's clinical volunteering or shadowing. But I got in without any formal shadowing experiences. So the notion that you have to shadow or the notion that you have to have hospital volunteering experience is just not true. It matters only as much as, you know, the fact that you're able to convince the admission committee that you're committed. That's it. This is the root reason for why we look for these activities, right? It serves a purpose. Research, right? Medicine is fast moving. Just in lung cancer alone, so much has been discovered, right? Every year there's new therapeutics. If you don't keep up, you're not going to be a good doctor, period. It's as simple as that. So how are you going to keep up? Well, unless you know how to digest research studies, unless you know how to, you know, do continued med ed, you're not going to be a good doctor. So research is demonstrating to us you have this capacity for lifelong learning, but also we care about biomedical sciences, right? That's what we do as physicians. That's why we care. And you can read through the rest of these. And a lot of the questions I get also is about leadership, right? They're like, I'm a leader in this field, right? And like I'm doing this, like I'm in the student group, I'm a leader in that. Like I hate doing it. Like, do I have to continue doing it? And it's like the question, like, no, you don't have to do it. Pursue something that you're interested in, but at the same time still can demonstrate these qualities, right? Because at the end of the day, if you demonstrate these qualities, then we'll accept you. It's as simple as that. It's just that with certain activities, it's just kind of non-replaceable. For example, you're not going to get admitted to med school without having patient interaction in one way or another, right? That could be hypertension screening. That could be just like wheeling people in and out of the OR. Like, doesn't matter what it is, but if you don't have it, we're not going to accept you because we're not going to take the fact that you're saying that medicine is right for you, but you don't have any patient interaction experiences. Like, seriously, we wouldn't trust you. So think about the root reason. Think about the activities that you're actually genuinely interested in and pursue those. But also think about what qualities that med schools are looking for and try to fill in the gaps, right? And the key is to do something that you're interested in. Like I cannot harp on that enough because like so many students are just miserable, like piling on the hours, and it just doesn't get them anywhere. And I'll get to why, because when I get to the work and activity section, I look through the description and what they write. I can quickly tell if it's just a laundry list of what people have done. And it's very, very obvious. All right. Any questions so far? Feel free to like just type in any questions and along the way, and I'm happy to address any of it. Okay. All right. So the next thing that I'll say is, yeah, the point is to demonstrate through these activities why you'd be an excellent clinician, right? So don't fix it on the hours. Don't fix it on the numbers. I've seen a lot of students who are just like really just driven to get as many hours as possible. Like, just don't do it. That's not the point. Okay. Seriously, it's not. Fixate on how to demonstrate these qualities that you have. Okay. And I'm going to repeat again because people find it very surprising when I say this. I did not have formal shadowing hours on my application. Okay. And I'm happy to answer like how I made up for that. But like when people meet with me for 30-minute free consultation, they're like, I got like 500 hours of shadowing experience. I'm like, holy crap, dude. That's a lot. What have you learned from it? And they're like, well, like, you know, I like hemonc. I like surgery too. And I'm like, okay, let's try to build on that. So try to focus on the qualities that you want to demonstrate. Okay. You need to be very strategic about how you spend your time and don't waste your time in doing something that you're not interested in. And this is why a lot of students work with me starting freshman year, because they don't want to waste time and do like extracurriculars. And then they're just like, well, you know, all right, so let's get to a workshop. So this is a student that I helped. And so you guys can read through this. I'm gonna be quiet for a second. And I'm gonna ask you guys a question after you read it, okay? All right, so I wanna make this interactive. So I'm a very slow reader. So if you're still reading, that's totally fine. But please, whether it's chat or whether it's video or whatever form of communication, whether it's pigeon, I don't care. Let me know what you guys think of this activity description. No right or wrong answer.
I think it illustrates how they really like saw an impact of like being in the clinical setting, and how like through this like scribing experience they were able to see how important it is to communication with like the patient is key, especially because like the patient depends on what the doctor says, and that's what facilitates like a really good interaction.
Yeah, no, that's great. So what is your name?
Sorry, my name's Pratush.
Pratish, thanks so much, man. Appreciate it. So I completely agree with you. This person knows what, I mean, I know this person, so I'll just say she knows what she's talking about. So this is her first draft. She sent to me. She was very proud. She was like, this is my activities description. What else? What other thoughts do you guys have?
I mean, personally, I think it's really good. I've gotten like the sense of like you're supposed to describe what you do, and then I've also like heard people say like you're supposed to describe like the significance. It seems
Yeah.
like this is focused on the significance.
Yeah. So that's a good point. It's on me. I should have clarified. This is one of the most meaningful experiences for this person. And so this is the second spot that she got. So it's not like the main working activities where you describe the hours and all of that. It's the significance. So thanks for clarifying that, Tim.
Yeah.
Other thoughts?
Oh, Megan's saying there's a lot of I.
There's a lot of I. Yes. Yes. And you said that was Megan?
Yeah.
Okay. All right, Megan. Thanks for that. And yeah, I would agree with you. Anyone else?
Instead of saying I work diligently, it would be better to show a story, or show it, like give an example of that instead of saying it directly.
Yeah. So that's a great point. All right. So here, I'll give you the bottom line of this. This is a decent description. Okay. For the following reasons. This person obviously understands the significance of trust, of the language barrier that exists, and the importance of trust in facilitating positive outcomes as well as adherence. All that is great. Okay. But I say I would describe it as fine, or it's good, not excellent. We want to be entertained first. A lot of people seem to forget that. Second, we want you to show us that you understand. We don't want you to lecture to us, right? Obviously, the word usage of lecture is kind of harsh, right? Because, this person didn't mean it to sound that way. But it's way better to demonstrate rather than just tell, okay? So I especially like the fact that someone said this person uses I a lot, because it's just like, I think this is important. I think that this is blah, right? I did my job. I want to do this. All of that is fine, but it comes off sometimes as kind of preachy and very kind of moralistic, and like, I know what this is about, right? Again, the student never intends to do this. And I would never actually just think that she intended to do this if I read this file, right? This application, but it has the risk. So 2 points. One, I want to be entertained. Two, I want you to show me that you understand. So here are the highlighted parts. As a French speaker, I understood the disconnect, right? Okay, you understand the disconnect, fine. I work diligently to bridge the gap. Okay, that's fine. Trust is essential for positive outcomes, and therefore communication is key. It's like, someone who's like kind of senior in the medical field saying this to me, like, and I'm in a lecture. That's the sense I get when I read this.
Yeah.
And I care about patients. And by the way, as I said, this is a decent working activities, right? Description. My goal for all of you is to write an excellent one. So this is good. This is good. Here is her second draft, and is a lot closer to what she ultimately submitted to schools. Read this. I'll shut up again. All right. So this is a second draft. And one of the techniques that exists to entertain someone and to make sure you can demonstrate what's going on is to use a story, right? And this, she was talking about one of her patients, right? And you can tell that she understands all of those things, right? You can tell that she understands the importance of communication, language barrier, trust, positive outcomes, all of that. But it's more visceral now, and I'm entertained. I like it when I'm entertained. I don't know about you guys. So this is a better one. This is a lot better, I would say. And I would say that aside from this change, another important thing that is different, that is very strong, is whenever you want to say something and it has the risk of sounding preachy, right? Always translate it into a lesson. Okay.
Wow.
So when you tell me that you learn the importance of trust and how it's important for facilitating positive outcomes and adherence, right? That to me tells me that you've learned something, you're humble, but then if you say like medicine, at the cornerstone of medicine is trust and communication. Do you see how my voice changed? And I'm obviously like kidding around, but it has the risk of coming off as preachy. And I can tell you right now, physicians are extraordinarily hierarchical creatures, right? It's just the way it is. If you come across as preachy, you're subconsciously not going to come across well.
Wow.
Period. So that's another one. Okay. What questions you guys have before I move on?
That was like a huge lesson. It makes so much sense when you say it, but like actually, coming up with that on your own, like thinking that way, it's a little tricky. But
yeah. Any other thoughts?
I have
one question. Oh, sorry. Yeah.
You can go.
No,
Yeah.
no,
Okay.
Don't fight over me, you guys. I'm here.
I guess how is it like okay to be like technical when you're talking about like specifically like in this example where she mentions like
Gabapentin?
the back pain and like the gabapentin example, just like I guess how technical is too technical is my big question.
Yeah. So I'll share with you an anecdote. So this person who was doing research study, and it depends on the research, right? Like you don't even have to want to come across as like very pedantic, but like her research description was like this long, like literally, like with font like 9. It was like investigating the role of like gate channel ATP7. Like it's like, dude, stop. That is a little bit technical, like at that level. So like it should serve a purpose, right? So you should try to extrapolate exactly what you're working on and what you've done without going too technical to the point where you're just like losing people, right? And what I mean by losing people, a lot of people who are going to read your stuff are physicians. But at the same time, if you like name a research study that's like very niche, you're not going to understand it. So just keep that in mind. So I hope that helps. If you have a specific example, feel free to type it out or let me know, and I can just let you know if that's too much.
yeah, I think one of the trickiest parts is, how specific do you want to be without, leaving out the big picture, right? That was one of the challenges that I had doing the experiences and also doing secondaries.
Yeah. No, it's totally a fair point.
Yeah.
I would say that for me, I was like ridiculously vague.
Okay.
I think I said something along the lines of like investigated the relationship between chemosensory tests and neurodegenerative diseases, which was like, that is like a very big field.
Mm-hmm.
But the important thing is like, we know you guys aren't PIs. If you are, please say that you are. But other than that, like what you've done is important. And how what you studied is relevant to your passions and interests is important. After that, it's all details that I don't need to know.
Interesting.
Yeah. If you are applying for a grant, that's a different story, right? But in this case, you're trying to like emphasize your interests, your qualities, and the types of research that you're interested in. So I hope that makes sense. What else?
Now, in terms of like clinical experience, you would recommend going towards like describing your relationship with patients more than everything that you're doing, right? So that's kind of what I'm getting the sense at.
Yeah, so here's the thing. It has to be a balance. So I want to
Mhm.
know what you've done and how long you've done it. So as I said, that's why I appreciated you pointing out the fact that this was not typical work and activities description. It was like one of the most significant, one of the three.
Okay.
So in those smaller, like shorter descriptions, I definitely want to know what you did. I definitely want to know where it was, what you've done, how long, right? The duration. And you could still fit in like a clinical experience or a patient interaction experience that you've had. But you know, try to not focus too much on the hours and all of that good stuff, because it's kind of like, I get it, man. You dedicated a lot of hours. So I hope that makes sense.
Yeah, and plus you put the hours in like that, that template slot at the top, right? So you don't really have to
Some
talk about
students like still put it in. They're like
Oh,
every week I did 12 hours like, for 7 months for 2 years. I'm like, you don't need that.
yeah.
Jeez. So that's what I mean. Yep.
I mean, for me, I was a little nervous sometimes that they wouldn't like know how it's broken up and then maybe not think it's accurate. I didn't do that like because my mentors told me not to, but that was like my thinking process going in. Just
Yeah.
like trying to make it authentic, like, so that they know it's real.
Yeah. No, it's a totally fair point. And honestly, it depends on the activity, right? So for one of my activities that I did, it was like a very independent project. And that's exactly what I did, because the first thought I have in regards to like independent project is like, who did you work with? How did you do it? You know, like, what do you know? Like, how did you do it on your own? So it depends on the context for sure.
Oh, interesting.
Mhm.
Okay. Because then when it's independent, you don't really have much of a reference back to like if it's not through an organization, then you kind of have to explain it a bit more in detail.
Yeah, for sure. And another thing that I will say for independent projects, because a lot of high caliber students just do independent projects because they can. If you do have an independent project, make sure you have a faculty mentor. Faculty mentor, preferably multiple, and also have like an organizational backing, whether that's your university, local high school, whatever it is, because that's important.
Okay. Wow.
What else?
Yeah, so I had a question.
Yeah.
So with this specific draft, I guess the student decided to focus on like a specific aspect of her extracurricular activity, which was like communication. But what advice do you have for like let's say like the student had another aspect that she wanted to highlight as well? So would you like incorporate both communication and like the other one in one passage, or um,
Sorry, you cut off exactly at the most important moment, which
oh,
often happens. So what was that?
um, so essentially I'm asking like what advice do you have for someone who has like a medical scribe experience that um, kind of has importance in both communication and something else? Would it be too like fluffy or too much to add both aspects in one passage, or you have another opportunity elsewhere?
Yeah, no, this is a really excellent point. Okay, so which is what I was going to get to actually. So it's a great segue. Thank you. This person, whoever you are, is not a plant. No. So here's the thing. You got to be really strategic. And again, I come back to this essential point. Your activities will demonstrate who you are and your qualities and your characteristics, okay? So these are like proxy measures or proxy ways of demonstrating who you are, okay? So when I work with students one-on-one, that is exactly what I do. I look through all of their activities, distill what kind of qualities they can emphasize with each one, and then be very strategic about how they convey that in the work and activity section, right? So to your point, you say that, one of your experiences, you learned two things, or two things were very important to you. The quick answer to that is it depends on your application and what qualities you're trying to convey. The three most significant activities, I work on that like crazy with the applicants, because as soon as they read those three things, they should be able to take away core qualities that you're trying to convey. So, it could be 3 qualities, 4 qualities, 5 qualities, as long as it makes sense. And so I can give you an example slightly later on. Let's see here. Let me just go to the next one. Yeah, I mentioned the entertainment part. Yeah, and exactly as you said, you want to be strategic, right? Let's see. Yeah, I think that's it. So I can quickly go through an example with you. So, if you are just think of a really famous person. Let's just think of one. Mark Cuban, let's say, right? You guys know Mark Cuban, or Elon Musk, whoever you like, just pick one, right? If that person writes in the work and activity section, and let's go ahead with Elon Musk and says founded PayPal, and other people didn't know what PayPal was, that person would describe it very quickly, and then that person would obviously write down what the core activities were, right? But just take a step back for a second and think about what that activity represents and what we're able to distill and what I will take away from it. This person is a self-starter, creative entrepreneur, right? Who solves problems. That is what that person is conveying to the admission committee with that activity at the core. So you don't want to pick 2 other activities in your most important, significant activities list that convey the same qualities. You just don't, right? Another activity that could complement that, obviously for med school applications, is clinical experience, right? So if Elon Musk did clinical experience, like, you should definitely mention that and not mention SpaceX. It's impressive. Should not mention SpaceX, right? You get what I'm saying. So it should be very strategic and thoughtful about how these qualities and experiences are conveyed. Let's see. Yeah. So any other questions?
So you kind of want to convey these without directly saying it.
Yeah. So, okay. So you do want to say it to a certain extent.
Oh, you do? Wow.
So you
Okay.
do. So this is why. So I usually encourage students to have like, this is what I learned, right? Because like whenever you're reading through a lot of these, like you pick it up, right? Just viscerally, but at the same time, you just want to drive home the point. So usually I get students to just write it down at the end, right? So going back to the Elon Musk example, a way to do that without being obnoxious about it would be like, started PayPal, learned a lot about how to be a self-starter, creative, and solve real world problems, right?
Okay.
So that would be an example. And you gotta obviously be very careful about your tone, because I don't like reading people who are, even if they're highly successful, like very kind of, full of themselves. So you guys can feel free to ask me any questions. It could be related to extracurriculars. It could be related to just life. I don't care. Happy to help in any way. I'm just writing down kind of where you can sign up, and if you need help, just feel free to sign up, and get my thoughts on things. Just happy to be helpful. What questions do you guys have? I'm fighting with Zoom right now, so while I do that.
Yeah, I wish I had these videos going into the application cycle. That would have been helpful.
Thank you, Tim. That's very nice of you. But you know, you're a rock star, so I'm sure things will work out.
Thank you.